Dengue fever continues to spread as the number of indigenous cases approaches 20,000. The Centers for Disease Control say hospital beds are now difficult to obtain in the hardest hit area of Tainan. Frontline healthcare workers are also nearing the point of exhaustion. Today, the Taiwan Association for Promoting Public Health criticized the government for taking advantage of local public health centers.
Here someone is acting out the role of a public health nurse who rushes to provide medical treatment, health education, and registration. During this outbreak of dengue fever, the workload has dramatically increased, and yet this public health center has less than 10 staff, including doctors, pharmacists, and nurses. Despite the limited staffing, they need to perform nearly 100 different tasks.
Public health centers have long been neglected and receive very little money and manpower, and yet they still perform a lot of duties. Now with the dengue fever outbreak, their work has increased significantly.
This continued spread of dengue fever has led public health personnel to work overtime. Many are criticizing the government's prevention measures as being too slow, which has further exacerbated the outbreak.
It's very strange that we had 10,000 cases of dengue fever before an epidemic prevention and command center was established.
The current number of dengue fever cases in Taiwan is nearing 20,000, with former Health Minister Yaung Chih-liang estimating the number could go as high as 50,000. Yang called for the CDC to respond immediately, as frontline staff are nearing the brink of exhaustion.